Expert panel recommends new options for HIV prevention. The Grade A endorsement means that 2 additional drugs should be covered under the Affordable Care Act. An influential expert panel has given its highest recommendation to an expanded menu of HIV prevention strategies for adults and adolescents, a move that will require private insurers to cover the drugs without a copay or a deductible under the Affordable Care Act. The recommendation arrives as the Biden administration is fighting to preserve no-cost coverage of all preventive services under the A.C.A, after a Texas judge ruled the mandate to be unconstitutional. The ruling was aimed in particular at medications approved for use as pre-exposure prophylaxis, or PrEP, to prevent HIV, arguing that requiring its coverage violated the religious rights of employers. In the new recommendations, published on Tuesday in JAMA, the U.S. Preventive Services Task Force gave its highest or Grade A recommendation to 3 medications approved for PrEP. The new ruling updates the earlier endorsement of a single daily pill, Truvada or generic equivalents, for PrEP. The task force now has included Descovy, another pill, and Cabotegravir, marketed as a Pretude, an injectable drug given every 2 months. Generic Truvada generally costs $1 per day, while the new options may cost more than $20,000 per year. An estimated 1.2 million Americans are living with HIV thanks to powerful medications. The virus is not the death sentence it once was. Still, HIV is not yet curable, save for a handful of extraordinary examples, and preventing new cases is a public health priority. Nearly 31,000 people acquired HIV in 2020, and nearly 70% of those cases occurred among adolescents and adult men who have sex with men. A 2018 study estimated that more than 12% of men who have sex with men in the United States are living with HIV. We already do a really crummy job in our country of providing preventive services, Dr. Thomas Dobbs, Dean of the University of Mississippi's John D. Bauer School of Population Health, said. If we don't have no-cost access to some of the most essential preventive services, our poor health standing is only going to deteriorate. The new guidelines recommend that clinicians routinely ask patients about their sexual and injection drug use history. Doctors should offer PrEP to anyone who has a sexual partner with HIV, has had a bacterial sexually transmitted infection within the past 6 months, uses condoms inconsistently or never, injects drugs or has a drug-injecting partner with HIV, or engages in transactional sex, the task force said. The CDC, on the other hand, recommends that clinicians discuss PrEP with all sexually active adults and adolescents, and prescribe PrEP to anyone who asks for it. It's hard to tease out who might be a risk, and certainly sometimes those conversations are kind of tricky, Dr. Dobbs said. If people think that they need it, that's all that we have to hear to say yes.